restorations. In a post-endo restoration, if you ask me, first thing is I want to think about why do I need to do a post-endo restoration? Even before starting a root canal, okay, not after. It's like this, there's something called as a diagnosing a case. I know it's a root canal, but I ask my question, next is what? Can I restore the tooth at least to function, if not for cosmetics or aesthetics? If I can do for both, nothing like it. So that's called case selection. So select the case, only if it is indicated, please go in for it. So that's about consideration in treating endodontically treated tooth. And then we go in for protecting the remaining coronal tooth structures, restorative treatment planning of non-vital tooth, because it's non-vital root canal treatment has been done, evaluation of tooth or teeth, factors determining the post-selection, and clinical recommendations or considerations. This is what I thought I'll write for this paper. You can write another way also, but a flow chart, like I said. Anything can be thought about. So, assessment, I told you what it was. Between diagnosis and case selection is important. If the case is not right, it goes out. You go for the next procedure, maybe an implant or a bridge, I don't know. Considerations in treating endodontically treated tooth. What are the considerations? Of course, anatomy. How deep is the curvature? How short is the curvature? How acute? Can I put a post? Can I put a knot? Biological. Does it have a good ratio, crown-root ratio? Is there enough bone support? Or mechanical. Will it help me or not? After doing, is there a thing? Or is it going to crack or fracture or it's not going to help me at all? Protecting the remaining tooth structure. This is a very important point. Most of us fight to get it all the time. It's nothing but a resistance form of a cavity. We have forms like outline form, retention form, resistance form, convenience form, and then it goes on. We forget actually. Last is toileting of the cavity, right? So the resistance form is this. Feruling is nothing but encompassing the tooth with the cover structure. It might be a tooth ferrule or a core ferrule or a crown ferrule, whatever it is, that you can decide on the tooth remaining. But you need to put something on top to cover it. That's how you help tooth and the processes together. Restorative treatment planning of non-vital tooth. Why I put core here is, core is 100%. Every root canal you open, you need to close. And that's called the core built up. Post may not be every time. You don't need a post. If there are good tooth structure, the strongest portion of the teeth, I say, like what are they? Say oblique ridge, say marginal ridge, transverse ridge, cusp tips, or cingulum. If these are intact for any reason or all reasons, then don't need to put a post. Don't have to destroy the tooth. Just close it with a core built up. It's enough. So evaluate the tooth well. Once you evaluated it well, okay, core materials. There are so many core materials. You have a composite material, you have amalgams, which has been covered in earlier lectures, I saw that. You have cast gold, you have onlays, you have endo crowns, you have inlay onlay type of materials, and you have a full crown. Anything is possible. Slowly, of course, we are doing less of full crowns, coming to endo crowns more, okay? Evaluation of teeth. Anterior teeth have got different evaluation, posterior different. You know why? Structure and the make and the positions. Behind we use for chewing. It is strong. If a person's masseter is developed well, we know his teeth are going to get flatter soon. He's going to lose his vertical height of the face. The canine guided occlusion. It's going to be a group function. The incisal guidance. These things go away. So you need to understand these things. So of course, this will be a little bit of prosthodontics now. So evaluation of teeth is important before going for the next step. We also have something called as factors determining post-selection. So what are they? Of course, very classical in every book.